Good evening, I'm Kristi Risk, and I'm here with Sarah Seaton, registered nurse and a director of nursing at a local school. We also have Dr. Julio Marera and his wife Pilar, who have come to America from Cuba, and they're going to share with us their thoughts and their opinions on the Obamacare and socialized medicine and what that really means for America. So welcome.
Thank you for having us. Thank you.
And we're so excited to have you share and give these people the first-hand view of what's going on and what you see is going to be happening in America over the next few years as Obamacare is implemented, if we do not repeal it, which we definitely need to do. So, Sarah, do you have some thoughts and questions?
I do. I've been a registered nurse for 19 years. I currently chair a school of nursing, bringing on the next generation of registered nurses in this country. And I've always been proud of my profession and everything that it does for the patient population. My biggest concerns are the tax that the Obamacare is going to place on my profession. The ability of registered nurses to meet the needs of an increasing patient clientele. And, you know, I talk often to students and other nurses about what these concerns really are and are they legitimate? And, you know, are we going to see this influx of patients into the healthcare system? And a lot of people say, oh, it's not going to mean anything. We're not going to have the extra 15 million people in the healthcare population, but I'm afraid that we are. And I think about if the local convenience store was giving away free milk, and you heard on the radio that milk is going to be free.
Right, everybody's going to.
Right. If you went yesterday and bought 2 gallons of milk that would sustain your family for 2 weeks, if somebody's giving away free milk, you're going to go get it whether you need it or not.
Absolutely.
And so I really feel like we're going to have an influx of patients into the healthcare system that we as nurses, we're already entering a nursing shortage, the greatest nursing shortage this country's ever seen. We cannot turn over enough new nurses to meet the number that are retiring. And to throw in an additional 15 million people into the healthcare system, I think is just going to be disastrous for my profession.
So Dr. Marera, you came from Cuba, and Cuba has socialized medicine.
Yes.
Can you tell us a little bit about what it was like for you over there, and then what did you go through to come to America?
I came here many years ago. I was only 12 when I got here, and Castro had not been in probably 2 years, so I really couldn't talk about what was going on then about medicine and socialized medicine. However, I lived in Spain for 6 years as a medical student, and I saw some of the pitfalls on a system that probably is better than what I see coming. I haven't read it all, but what I see coming from the Obamacare.
So let me ask you, on your system, did it include things like housing and real estate and loans for students and different things like that? Did it encompass all different areas, or was it just medicine?
There was a lot of responsibility, individual responsibility. The state gave a lot. State gave, the tuition for medical school there is a joke compared to what is here. But you see how Spain is doing now. It's going broke.
Right.
And once you give something like that, you depend on it, it's hard to take away. And we better do it earlier rather than later. There's a lot of things, though. As a little example, emergency room medicine is very expensive. If you have a public system that's overloaded, and you will have to get a number, and at 5 o'clock it closes because you're not going to make any more money whether you work hard or not, which will bring you down to the lowest common denominator anyway.
So you're saying that in the Obamacare you will have a salary and that's it? It doesn't make any difference.
It'll end up being like that.
Okay.
And you know, the thing is that people that don't get seen right away, they'll go to the emergency room.
And then we have the free milk problem.
Exactly.
Right.
And you know, one more thing. I mean, what's very important to me is that we have most of these socialized programs, and that I can tell you from when I came from Cuba. There's a grain of truth in whatever they complain about. you know, our system is kind of sick. It needs to be fixed. But it shouldn't be thrown away and gotten into worse, you know, like jumping from the frying pan to the fire. And that's what I'm seeing coming.
See, your father was a physician in Cuba.
Yes.
And he made a great sacrifice in sending you here.
Yes.
Why did he do that?
Because he saw what was coming, even though it was early. I can tell you, I saw pictures in TV, the trials of the bad people that they were, and I saw him getting shot on TV. That's something you don't want your father to you know, I mean your son to see. But he did make a big sacrifice, and actually he made a big sacrifice himself. When he first came in, 55 years of age, he picked tomatoes for a month before he got a job.
Wow, tomatoes.
Yeah.
And was he a physician when he was picking tomatoes?
Yes.
Okay.
But
he was a hard worker. He understood work ethic.
Well, right, he did what he had to do.
He did what he had to do.
For his family. And I mean, there's nothing to be admired. I mean, I admire them tremendously, even though he passed away. But I mean, to send your kids away, like many people have done, you know, to send your kids, you don't know, but you know something, only one thing is true for them, they're going to be free. And to risk not seeing your kids ever, because then you never knew they were going to get together again or not.
Right. Now, Pilar, we talked, and Dr. Marera, of course, is sharing from the understanding of socialized medicine, but you have a passion for America, and you love America.
I do.
And you're proud of your citizenship.
Oh my goodness, yes, because I mean, coming here, and I knew, how, I don't know, it was 70 something, and so I knew
74.
What America, when people would talk about America and Spain, and you know, and it was like, well, the land of opportunity. You were someplace that, well, then if you could come here, it would be like, I don't know, and some of this world, you know.
Yeah.
And so I feel very fortunate. I saw a country when I came here that, yeah, it was everything that I heard about it, and maybe even more. Because there were some things that, you know, an actor becoming a president and all that, you know, so only in America.
Go ahead.
Is this the same America?
That's what I was going to ask her.
No, not at all. And what have bothered me is that we had started to hear about education and how the education had to be fixed. And I think after 30, how many years I've been here? 30 a lot. And we, yeah, 30, I mean, I think 38, 35. And Washington hasn't fixed it. It only has gone worse. And a democracy cannot survive without educated people. And I think I see that it has gone down so much that people can be tricked into something so easy. Because America has been lucky, it's a very big country, so it's very well protected, and they haven't been living like Julio was born in Cuba, that was communism, but I grew up for 20 years under a dictatorship. And so I know what it is. I know what it is when the government cuts movies for you, when the government tells you what you are going to read, because everything needs to pass through them, and the kind of care you are going to get, and the health care you are going to get, and I don't know, and what I see has changed so much. What I see in Washington now is a ruling class, telling the rest of us that we are like drones to, you know, what we want, what we like, and you know, and the Obamacare is very scary. I grew up there. I went to the doctor. Yes, you're going to get a number when you go to the doctor, because there is no other way. Just like when you go to Snooks, you get your number in the deli.
Right.
Yeah, you know, but so better wake up early in the morning. And when you have to go to the doctor, if you work, just give the day up.
Yeah. So, Dr. Marera, you grew up in communism, under actual communism. And you've come to America, and you have seen a transition from when you came to where we are now. What are some of the pitfalls that you see America heading towards? And how How is Obamacare going to, expedite those pitfalls?
Healthcare is one of the most important things that you give to your family when you go out to work to bring food to the table, but also to ensure that they're safe and getting the best that they can. Let me give you an example compared to what's going in Cuba. I see this going towards that. In Cuba now, you have pretty good doctors. You got pretty good doctors, and you may even have a few good facilities to take care of the patients. However, you don't have the infrastructure, and that's what's going to happen here. Not only the infrastructure, the care will be potentially could be good, and that's what you see in the propaganda things. But the results are pretty bad because it's just not complete. You cannot get a complete care where you have a few people in government who have no idea what medical care is, making laws. I mean, making the way medicine should be run. It just boggles the mind.
Yeah.
And on top of that, squeezing it in like they did. Just by that fact, it's not going to be any good.
So Sarah, do you see any chances in the future of a decline in people wanting to become nurses because of the Obamacare? Is this gonna do the opposite? Instead of people wanting to go into a profession where they're compensated well, you have overtime, and you get good pay now, could that be reversed and people say, you know what, I really don't want to go into it because I don't want to work under socialized medicine?
Certainly. Nurses pride themselves on a sense of autonomy, the ability to make decisions in the best interest of the patient based on their knowledge base. And if that's taken away, which I think it will for both nurses and doctors, when you have a schematic that says, if A, then B, without taking into any other considerations, individualizing it for the patient, that's just going to lead to frustration for nurses and for doctors. And I think that we'll see an outflow of healthcare professionals for that, as well as, when the government's paying the bill, they set the standard. They set the standard for wage, for compensation and other benefit packages, and they're going to do that at the expense of what's right for the nurses as well as the physicians.
Oh, definitely, because you are talking something that, deja vu. Yeah, that's how it is. It has to be. There is no other way, and it is.
And when doctors, when nurses have to deal with this influx of patients into the healthcare system, we're not going to be able to provide the care that we have prided ourselves in for many, many years. And that additionally leads to frustration. And when you feel like at the end of the day you haven't done everything for your patients that you know you should, that's not a sense of guilt that healthcare professionals can deal with. They'll leave the profession.
So you both talk.
Yeah, and then I was finding something that something that I can share very recently, like last year. Was last year? No, very. But anyways, my brother had a problem with his eyes, and he had to his doctor, and what is called Social Security, and it says, well, if I were you, because it was an emergency. He said, if I were you, I'll get the train or get the car, go to Barcelona, get the operation, and then deal with, because the government, well, the government healthcare is not going to take care of this. And you're going to lose your son, I said, then deal with them, of course. That's what my brother did. Everything went very well. Then he decided to ask for the government to pay for something, and he lost. No, they didn't pay for that. But
and that's a difference. No, that's the difference between I guess, the socialized medicine that is not a one-payer system, and it's not a Canadian type of socialized medicine where you cannot go and to a private physicians. In Spain, at least, you had that outlet.
Now, you talked about your dad working the government hours and then going and helping people who couldn't